Hi, I'm Cecily Forsyth. I'm a haematologist and I've worked on the central coast of New South Wales for the last 25 years. In the last 12 months, we have increasingly moved to a very electronic focused or digital focused practice. That sometimes has been a little bit challenging, particularly for me, because I'm the old dinosaur of the practice, but it really has had enormous benefits. And the things that really have happened in COVID to push us along, I think there are three main things. The use of video calls for telehealth, the use of and availability of e-scripting, which would be my secretary's favourite thing, and thirdly, of course, the introduction of My Health Record. I use that with every single patient consultation. It's really one click to get into the My Health Record, and that brings up all the different components of My Health Record that I may want to access. This is very confidential, so it is only accessible by me, by the practitioners, with a practitioner login to the system. So there are lots of bits of it that I really like. First of all, the discharge summaries from the hospital. The discharge summaries from every patient in the public system is uploaded and available and extremely accessible. Second, I use the Australian Immunisation record really often. And I use that because a lot of my patients are immunocompromised. But I also find the medication and drug availability incredibly useful. So it's very easy to go into the My Health Record and immediately access what drugs are being prescribed and being collected, so which script is being filled from their pharmacy. And that's actually really useful for assessing patient compliance as well. Probably the other thing that I look at regularly from My Health Record for patients is if the patient has been seen by another specialist and they forget. Even if there isn't a letter uploaded from that specialist, there is on the Medicare overview, there is the ability to see who has been paid by Medicare, and therefore I know which respiratory physician they're seeing, and our secretarial staff can easily contact and get a letter. So all of my letters that I write are uploaded to My Health Record and readily available for other practitioners to look at, and importantly available for the juniors in hospital to have a look at, see the letter, see a management plan, see the diagnosis, because we do know that some of the hospital records aren't as detailed and correct as we would like. There are many other information areas within the My Health Record. I use the diagnostic imaging and find that is a good way of obtaining the imaging from the hospital. And the same for the hospital blood tests. That is really useful. There are other sections within the My Health Record, such as allergies and adverse events to drugs, which I do access occasionally. But usually I always ask the patient if they can't remember which drug it is, then that is also another good way of accessing that information without having to ring the GP. So there are many components of the My Health Record that I use on a really regular basis that make life easier, save secretarial time, which ultimately is an enormous benefit for the practice. I probably didn't understand how useful it was going to be when we first got My Health Record. Just embracing the change in the use of electronic medical records, digital health, over the last 5 years probably has been a little bit daunting for someone my age, and much more take it in your stride for 30-year-old medical specialists. But actually, I've really enjoyed it. It streamlines the practice, it improves the care for patients, and it makes things much better. So my sort of advice to people going out and setting up practice is you need to really get a fantastic electronic medical record and billing system that offers you easy access to My Health Record. It's improving access to information about the patients, improving accuracy, and generally improving communication amongst specialists, with GPs, with the hospital, really on many places where this has really just improved care for our patients.